So the characteristics of autism in children are related to social skills impairment and repetitive behaviors, but that is a little difficult for a family to understand. I think what we typically look for are red flags. What are the things that you should be paying attention to that bring a concern to you and that you want to explore further? For example, by about 8 months, a child should be able to recognize their name. They alert, they respond to their name, they might turn and smile at you. They know that you're trying to engage with them. If they're not turning to their name, we get a little bit worried, and frequently at this time, parents are worried that, wow, maybe their child can't hear. So we very frequently early on do hearing tests just to make sure that they can hear. Another red flag is that we expect a child by the first few months of life to begin smiling socially. So if someone smiles, they smile back. And so we look for that really very early in life. When children don't smile back, we're concerned that they're not beginning to appreciate that back and forth that is important socially. Another red flag is that children may not communicate using words or gestures. So we expect children early on, even if they don't have a lot of language, they want to communicate with their family members, and they want to be able to both share what they want and share enjoyment. They want to show their family members that they're really excited about something. So even if they have speech and language delay, what they will typically do is use facial expression, and they'll use pointing and all kinds of gestures to try to get their point across. So frequently children with autism will have speech and language delay, but sometimes children just have speech and language delay. Children with autism don't use other means to communicate what they want, what they need, what they want to show. And so a lack of really engaging all of their resources to communicate and share is another red flag for autism. Another red flag that we have for autism is in the realm of repetitive behaviors. And this is where a child will become very focused on a single item or a single toy. A child may become extremely focused on something that you wouldn't expect them to be focused on. For example, I see children who love brooms, and they love the strands of the brooms and playing with the different strands of the brooms. That's a different focus. There's all kinds of different things that children focus on. Sometimes they'll focus on one specific toy or one specific object that they will carry around with them all the time. And so we look for that. Just because your child has a particular interest that seems a little bit odd doesn't mean they have autism, but we do pay attention to these different types of behaviors. Another red flag is that children will become upset with changes in routine. So they may be upset that the arrangement of the home is different, that there are new and too many people in the home for holidays, that who typically picks them up at daycare or preschool is not the person that's there today, that their typical meal for breakfast is not available today. So it can be all kinds of things, but they get particularly focused. They want to know in general that what's happening next, and that things are predictable, and can get very upset if that doesn't occur. Another red flag is that children with autism may play differently. So they may play by lining toys up, by arranging them by color, or they may have, I think often they have a way of playing that we don't quite understand what they're doing, but it's often very fascinating, and they seem to have something in mind when they're doing this, and they get upset if you change what they're doing. If they go to daycare or preschool, they may play alone. They frequently will engage in games of chase. They like to run around and chase, but they may not play interactively, actually back and forth. What you often see on the playground is that children will observe other children playing. They might be interested, but they don't engage themselves in the play activities. They may have trouble sharing during play and get upset if everybody else isn't playing the way that they want to play. They may want to direct the play and really be in charge of everything, rather than cooperating and collaborating and changing the game based on other children's interests. So it is really important that parents pay attention to their child's development, and if they have any concerns, they need to reach out to ask for help and guidance. The first place I would go is to their primary care physician. This may be a family physician or a pediatrician who is frequently in the early years of life seeing a child frequently because of well child exams. It's a wonderful opportunity to have a conversation with your physician about your concerns and learn more about child development. If that provider has any concerns, they will send your child for further evaluation with a specialist who is a specialist in development. The other option is that in every state there is an early intervention program, and early intervention programs receive referrals from anyone. So a parent could refer their own child for an evaluation through, in general, it's an online system, and it can be done in just a few minutes' time. After that referral is received, the early intervention program will send a provider who is well-versed in all areas of development to interview the family at home and do some evaluations to see where that child is developmentally. If that provider has any concerns, they will refer them into the early intervention system for ongoing therapies and further evaluations.